It's a short little video, but it's an interesting little one. It shows how you can handle a subluxated lens with the femtocataract comparatively easily. Problem with all subluxated cataracts are fourfold. You stabilize the subluxated lens, how to do a rhexis, you phaco the residual nucleus, and you finally stabilize the IOL bag. Femto is extremely helpful, most important reason being that it gives you a perfect rhexis. It fragments the nucleus to enable slow motion phaco. Sorry, कुछ भी नहीं आया था पहले से करा. All right. Okay. So as I said, the problem is fourfold: to stabilize rhexis, phaco, and finally stabilize the IOL within the bag. And femtocataract is very useful purely because it gives you a perfect rhexis. It fragments the nucleus to enable slow motion phaco, and all this with no stress on the zonules. But you have to manually configure. That is one of the big problems. So let me show you how it works. Essentially, you set your data onto the phaco. This is the person with the lens. I'm just going to show it to you in a few moments so you know how it works really. And as you can see here, you notice the lens is completely subluxated downwards. So now the only problem is with this level of subluxation, you have to now set the femto to match it. If you can't match it, then it doesn't work that way. So you set it on both sides as well as the edges, because in case you don't set it properly in the edge, it tends to tear the edge. Once you have done that, then there's really not much of a hassle. Then the posterior capsule. In this case, as you noticed, because it is subluxated, the posterior capsule is all bent downwards. Once this is done, then the lens can be seen properly set, and we now have to set the iris plane on which it is going to set, so that it can have its judgment. You center the rhexis now onto where you want it to, and then you proceed. I normally just do a simple cross-hatching, which works fine, well enough. The laser works very fast. It's only basically a few seconds, normally about 4 to 5 seconds before the rhexis is completed. One of the reasons I'm cross-hatching it rather than doing lines is purely because it is easier to aspirate these lenses out if you cross-hatch them. Though I know that most people prefer just to use 4 lines and that is it. So once this is done, we take the patient off and transfer him onto the other side where you can now see the thing. Now as you noticed, the lens was very much subluxated. So the important thing is, before we do anything else, is to first fixate the lens. If you don't fixate the lens and the bag and everything will go on to the retina, which makes your retina surgeon very happy. Having done that, the next step is you've already done your rhexis. So that's not really a problem. Having done the rhexis, you just separate the rhexis a little off. Notice the rhexis floating free, and then use your hooks to anchor them on. Because it's a loose bag, using capsular hooks literally pushes the bag to one side. So I prefer to usually, in these sort of cases, to use just regular hooks. So we put 4 hooks and that stabilizes the bag. And once the bag is stabilized, then the next step is, of course, to feed in a Sioni ring, a capsular tension ring, CTR, which you feed in before you try playing any tricks with the lens. Because the first thing which you require is to stabilize the bag. Once you've done that, then you can aspirate out the lens easily. And the easy way of handling it is simply to push in the ring on one side, usually from the opposite direction from the area where the main rexus is. Let it fall back into place. And then inject your lens on top of it. One of the easiest lenses to use in this case is a Rayner, because it is sufficiently rigid to hold the bag in place and at the same time is friendly enough to remain there. And now that's as simple as that. Just a plug for iAdvance next year, though the dates may need to be changed since All India has changed its dates just recently.